You on when to start? Go ahead and start. All right. Welcome, everyone, to this is the business case for action, protecting workers amid climate and health crisis. I'm Lisa Patel. I'm both a commissioner for the National Climate and the National Commission on Climate and Workforce Health, and also the executive director for the Medical Society Consortium on Climate and Health. And it's my honor to get to introduce this panel. It's personally important to me as a physician. I've cared for a teenager who came in after working 108-degree temperature with the severe rhabdomyolysis and kidney damage on an extraordinarily hot day in Northern California. I think about farm worker Sebastian Francisco Perez. He was in Oregon when he dropped dead during the Oregon heat wave, and it took an event that severe to pass a law to protect him. And I'm thinking about the workers from Impact Plastics who worked for a plastics factory and weren't allowed to evacuate when Asheville flooded, and 2 workers died as a result. So we understand that the impacts of climate change are getting worse. We understand that indoor and outdoor workers need those protections in addition to helping to protect the workforce for healthcare to ensure that we continue offering services. With that, I'm going to introduce the moderator for the panel. I'm excited to introduce David Leathers. He is the Director of Program Strategy at Meteorite and the Program Director for the National Commission on Climate and Workforce Health. David, come on up.
Thank you, Dr. Patel. Yes, I will. Actually, let's all come up here, and I'll sit with you all, and we can start our. All right, hello everybody. Thank you for being here. I think this is the session between you all and the closing plenary, so we're going to keep it exciting and energizing. Talking about something that I think we've touched on in a few of the sessions today, but thinking about what is the role of the private sector and what is the business case for engaging the private sector at the intersection of climate and health. My name is David Leathers, and I'm with the Health Action Alliance. The Health Action Alliance is the nation's largest employer network operating at the intersection of business and public health. And in my specific role, I lead a program called the National Commission on Climate and Workforce Health. This commission and this program is about uniting business leaders, health leaders, and sustainability leaders to empower employers to understand and manage climate-related risks to their workforce. We think this is a sort of an untapped area of potential to better health outcomes and help employers understand that there is value and business case in it for them. Thank you. The commission was created by the Health Action Alliance in partnership with Mercer and strategic input from the CDC Foundation, and additional support and partnership is being provided by Elevance Health and the Hartford. So we're focused at the commission on building a playbook for action, helping companies become partners and leaders in driving better outcomes for workers and communities. We've talked a lot today about the challenges that this space faces right now, and while I'm not going to pretend that we can fill the gap of what has been lost and the challenges we're facing now, this is the opportunity for employers in the private sector to recognize that there is a role here more as climate risks intensify. I lost the clicker. Here we go. Perfect. So I will just have a couple slides, and then our amazing panelists will introduce in just a moment. We'll have a short presentation each, and then we'll have a panel and then some Q&A. So I think I'm preaching to the choir here in sharing that climate impacts are the biggest single health threat facing humanity. So I think we're all aligned on that. What we're doing at the commission is helping employers understand that these threats are workforce impacts. Right now, there's about 165 million Americans, adults, who are employed. So each one of those individuals have an employer thinking about them, thinking about their safety, thinking about how they're going to be productive and show up to work. And this is something that we're focused on, elevating that story and empowering employers to do something about it. We believe that if businesses can take action at scale, this can really start to have a transformative impact on health outcomes as climate impacts get worse. This whole day today, I've been inspired by the sessions and thinking, how can by engaging employers at scale, how can we help improve this? How can we help think about what happened in Los Angeles, what happened in Western North Carolina? There's a role here for innovation and how employers respond. Just 2 pieces of data I want to share to illustrate this story. Based on recent research from Mercer, 64% of workers have been affected by an extreme climate event in the past 2 years. That's probably no surprise to all of you. But only 4% of employers have conducted a vulnerability assessment to figure out who's at risk. This is striking, maybe it's not surprising, but that gap there, that 64% will continue to increase, and we hope, and we're trying, to make sure that 4% also increases and accelerates. We're also, just one piece of data that's not on the slide, we're starting to see evidence as well in some recent polling data we've been conducting that employees are, the perception of how their employers are communicating and preparing and helping them respond to disasters actually is a factor in their longevity and loyalty to the company. So we're excited to share some of that as well going forward. So the Commission and the folks on this stage and the broader set of experts we work with are doing 3 things. We're raising awareness and shifting the narrative to help businesses understand that climate-driven health risks are workforce risks and should be a business priority. We're empowering employers to do something about it. We have a number of resources that distill a broad range of academic work that many of you in this room and online have done into employer-facing language and tip sheets and things like that to help employers recognize that this is accessible to them. And third, we're also thinking about, let's 5, 10, 15 years in the future, what innovative benefits, employer benefits should be on the table? How should businesses engage with public policy around extreme heat? And what new technologies will need to be developed to support workers and where employers will play a role in that. So I will do some intros right now. There's a QR code up there, which is to our newsletter, shameless self-promotion, but we're sharing tips for employers that might be interesting to you all as well. And so today, with all the folks sitting here, up here with me today, I'm honored to be joined by an incredible panel of truly cross-sector leaders. Dr. Jerry Abraham is the Director of Public Health, Integration, and Street Medicine at CDU-KEDREN and the KEDREN Community Health Center and the Charles R. Drew University of Medicine and Science, and he's the immediate past president of Los Angeles County Medical Association. Hakon Mattson, right next to me here, is Chief Sustainability Officer at Elevance Health and also serves as a member of the National Commission on Climate and Workforce Health, and we're thankful for Hakon and Elevance Health's partnership on the Commission. Tracy Watts is a Senior Partner and National Leader for U.S. Healthcare Policy at Mercer and also serves as a member on the Commission. We're thankful to Tracy and Mercer's partnership as a founding member of the Commission. And Dr. Nadine Gracia is President and CEO of Trust for America's Health and also a member of the National Commission on Climate and Workforce Health. Okay, I'm going to hand it over now to Jerry with the clicker. Oh, there, right on there. And we'll go from there.
Great. I'll just be brief and just start from, I'm providing a front lines perspective as a clinician who helps run a street team at KEDREN, which is a historically Black institution, acute psychiatric hospital and federally qualified health center in South LA. I just wanted to, walk through the process that I always do whenever I present, especially with medical students, residents, especially since we're here at the Academy. So no conflicts to disclose, no pharmaceutical and industry funding, and not presenting any off-label uses of FDA-approved medications or therapies. In our presentations in South LA especially, we always do these land and labor acknowledgements, very important. And so for us in LA, we're on the land of the Gabrielino Tongva people, and we also understand the history of forced labor and everything that we are doing collectively to advance the issue of justice and recognize that. I also just briefly always mention SOGI data and why it's important for us to create safe spaces for people to identify themselves, my pronouns being any and all. And lastly, because I speak to different types of audiences, especially whether you're organizing physicians, medical students, business people, they may have very different perspectives, political ideologies, and so often the things that we're talking about may not feel controversial to us, but sometimes are, and so I just always make that case, especially as I speak to people in the South or in rural communities. So KEDREN, we're a federally qualified health center, and we prioritize Black and Latino health, and we're in the poorest part of LA, and a lot of our work is in the community. That's my team there, and part of what we did was we built a street medicine team during COVID-19, and with that came a lot of the challenges of working outdoors, seeing all the risks that are team take on, but also all of the realities of our patients living out there. And we're grounded in these principles and mantras in our team. So what does it mean to meet people where they are? Our team goes out to where people live, work, worship, play, where they go to school. We go to those that are homebound, and we also care for those experiencing homelessness. But in doing so, you really better understand the condition of people with certain priority problems. And so for us, those were the priority places. There are priority problems that our patients are facing. And so we learned a lot during COVID-19. We thought, how do we take not just COVID-19 and its vaccines out on the road, but rather can we also deliver healthcare services addressing the health impacts of climate change, for example, when we're caring for patients on the street. And these are the priority people that my team helps care for. So how does climate impact people experiencing homelessness, those with substance use disorder, serious mental illness, people living with HIV, those that are justice or institution involved, and so forth. And so for us, that meant that we had to learn. These are not things that we learned in medical school or residency, so kind of took it upon ourselves to train our team, our clinicians, on what were those health impacts. And so really understanding the role of air quality, especially as we're standing outside mobile clinics, for example, the even just occupational hazards that we face, the extreme heat that ourselves and people experiencing homelessness, for example, beating the pavement, it's very hot in LA, and then most recently the wildfires. And so what are we going to do? How are we going to prepare our communities? And no one here needs to be reminded that communities of color, older folks, children are disproportionately affected. As a result of redlining, our communities have been disproportionately impacted. We live nearer to highways, less desirable parts of town, suffer more health harms, asthma, et cetera, as a result. But what was nice is that there are frameworks that can help guide us to getting to these solutions. And that's something that we've heard a lot today about adaptation, mitigation. And for us, we also always add in that lens around education and also on addressing the equity issues. And so that's really been inspiring. But for us, it's how can we better protect our patients, better protect our staff as we do this work? And it's only worsening, and we don't really speak the language that the folks up here speak. So as the physician on the panel, how to make that business case has always been a challenge, especially as I try to convince my bosses and the C-suite, we have to do more. We have to address this, not only decarbonize what we're doing at the hospital and the medical school, but clearly how we're going to address extreme heat this summer. How are we going to help with medical evacuations and other climate-related disasters? How are we going to build up what we have here in South LA and be ready and resilient? So that's kind of where we're coming from. The last thing I'll just mention is these are the things that we are working on in Los Angeles right now. So we are preparing for another extreme heat event this summer. So how are we going to communicate? How are we going to activate the healthcare workforce? But in doing so too, we're already burned out. We're already feeling the heat literally. And so many of us are not ready for another disaster or an emergency. And that's really going to be a challenge as we move forward. And of course, we're very concerned about future wildfires and other disasters as well. So that's a little view from the front lines in Los Angeles.
Thank you, Jerry. Now we'll move to Hakon as well to talk about the work that Elevance Health is doing.
Great. Well, first, thanks for the opportunity to be here and connect and have a conversation. So I've heard several times today that, hey, the payer is not in the room, and want you all to know that the payer is in the room. So Elevance Health, most folks are probably familiar with our commercial line of business. It's Anthem Blue Cross Blue Shield. So we manage about 45 million members' health benefits. We also have a behavioral health services company. We have a specialty pharmacy company. We're in Medicaid. We're in Medicare Advantage. And so we're kind of across the health ecosystem, mainly as a payer, but also as a provider and service consultant. We operate in these regions we've been hearing about today. So we have members in Northwest North Carolina. We have members in LA. We have members in Puerto Rico that I just read, an article last night that they're still dealing with grid reliability issues here several years after Hurricane Maria devastated that island. And we have employees all over the place, including internationally. We have employees that are in India that are facing water security issues. So climate sustainability, it's important to the payer, just as much so as it is important to the healthcare provider. Which one did I push here? Big green, makes sense. Uh-oh. So I just wanted to offer a little insight about how we're thinking about this. So I come from more of a traditional corporate sustainability background. I don't have a clinical background. But over the last couple of years, I've really tried to better align how we think of sustainability as a Fortune 20 company, how we think about it and how we think about it aligning with whole health and better health outcomes. And so it gets into quality, it gets into health equity, it gets into these topics that we're talking about here today at this event. And so for us, we've organized our strategy and our thought process into 3 different pillars. You know, the decarbonization, I'm not going to go into detail on that one, but decarbonization is important. I think it's important, you know, for us not to decouple decarbonization from a lot of the work that we're doing in the resilience space and a lot of the work that we're doing that I'm going to talk about here in a minute, specific to better understanding some of these environmental exposure impacts. The one thing I did want to say on decarbonization, I think you all may find it interesting. We're doing a lot of work in scope 1 and 2 and 3 and across the board. But the one thing I think could be interesting to this audience is the fact that we have implemented a measure as part of our hospital and insights quality incentive program. So if there's anyone in the room that's part of like a quality team for a health system, this is the QHIP program. And so for 2025, we've implemented a bonus measure focused on energy efficiency, so reducing waste within healthcare, which translates into decarbonization. And so this measure, it's a bonus measure, and this year's really a pilot. We want to see, you know, if this resonates with healthcare systems. But this measure, it's built on the Joint Commission's voluntary sustainability certification. And so it's just our way as a payer of attempting to do something in the space of some sort of incentive for healthcare providers to try and move the needle on decarbonization, with the primary motivation being, once again, reducing healthcare cost, reducing energy burden. I'll talk about the 3rd pillar just a little bit. So, you know, we're a large employer. We're in all of these communities. We're thinking about climate resilience. I just wanted to give one kind of specific example that, once again, I thought you all may find interesting. For the LA wildfires, you know, that's a major community. That's a major market for us. One of the things we did that was a little bit outside of the box was we identified 100,000 of our members through our data analytics that had some sort of lung condition 6 months leading up to the wildfires, and we proactively reached out to them via text, via phone calls, and put them in touch with a nurse case manager that could help them navigate different resources that are available, whether through their health plan, whether through their provider, through the local community. And we found it as an effective strategy, just proactively like talking to folks that could be most impacted by this wildfire smoke. The other thing we did in LA, so we have a charitable foundation, as most large companies do. You know, we tried to kind of use the power of our dollar, the power of our funding to help in those communities as well, with a big focus on behavioral health, mental health support, which I've been happy to hear folks talking about that throughout the day. But it's a major component of any climate resilience strategies. It's just critical. It's important. And so the last pillar, this is the research agenda. We've created a research agenda at Elevance Health, trying to better understand, you know, what these environmental exposure impacts are, so that we can help advance whole health, but also so we can identify any climate-related risk. And so for our company over the years, you know, I've led sustainability. I've responded to, you know, climate risk surveys and CDP and these other things. A lot of the focus has been on balance sheet assets. It's been on physical properties, physical damage. There's never really been a focus on humans and human capital. And so we wanted to better understand, like, what is our financial risk specific to climate-related events? And so we've taken on this research agenda. We started with, you know, a CKD, chronic kidney disease population, about 900,000 folks within that study, which we recently published, as you can see on the screen there. And then our research now is focused on a much larger population. So now we have 35 million folks in our research sample. And this has not been peer reviewed or published yet, but just going to share a little bit of high level insight. You know, we're seeing the impacts. So this is extreme heat across the 35 million member population that we assessed. We're seeing about a 1% increase in utilization for days over 80 degrees compared to a baseline of a day between 60 and 70 degrees. What gets interesting is we also look at cold. And this isn't really being talked about that much, but we're seeing more hot days, but we're also seeing less cold days. And so for a payer, for a health insurance company, we're interested in both because it translates into utilization and cost. And so on cold days, we're seeing over 1% decreased utilization. And so if we say that, hey, like there's going to be less cold days in the future, not only are we being impacted, if we're saying there's going to be more hot days and less cold days, we're impacted on both sides of the equation, and we need to account for that. So once we kind of translate this into dollars and cents, it's about $15 or $16 per individual per year across that 35 million person population. The utilization translates into about 120,000 emergency department visits, which is quite substantial. I was trying to find something to kind of put it into context, and what I found was like a flu outbreak, uptick in flu is the equivalent to what this extreme heat is doing to the system. So, and I'm hoping to get into a little bit more of this. I know we're going to have a little bit of Q&A and can talk a little bit more about it, but this I see as our number one contribution in the space. Lots of work in decarbonization, lots of work in community resilience, but using the power of our data and the analytics to help understand what's actually happening so we can affect change, I think is critical.
Thank you, Hakon. Thank you. Tracy, over to you.
Okay, try 3. I'm with Mercer, and we're a global consulting firm. The type of work that I do is with employers primarily based here in the U.S. on their health benefits for their employees. And the whole idea behind this National Commission on Climate and Workforce Health was to bring the workforce health aspect of it to the forefront. And several people have mentioned that, you know, Hakon, you said that the focus is on physical plant and supply chain and, you know, the other aspects of the business. And we were trying to figure out, you know, how to bring the human capital aspect more to the forefront. David shared some data on what employers are doing and not doing. What you see on the screen here is actually research that we did with 2,000 workers here in the U.S. a little bit earlier this year. This is pretty fresh data, where 77% of them said that they had experienced some type of climate-related financial or health impacts. So that's 77%. That's significant. What I found really interesting, though, is on the right-hand side of the screen where you see like 28% said that they had worsened health conditions as a result of it, and that's to be expected, especially those with chronic conditions, that this would make those conditions worse. But look at the second line, the difficulty sleeping due to high temperature. That's a safety issue. When you think about people that are in jobs where they drive a truck or they operate heavy machinery or they're doing something that's very intricate and tedious and they need to be at the top of their game, all sorts of impacts from being too hot and not getting a good night's sleep. You see anxiety on the screen as well. And then, of course, oftentimes with these extreme weather disasters, it wipes out our ability to access care. So this is from the worker perspective, which is an important voice here. What we really wanted to do within the commission and at Mercer was to help drive the urgency with business leaders. And from where I sit, CFOs in particular are very focused on what the overall healthcare costs are for providing care to their population. They're very focused on what is the trend. And for those of you that don't watch that, like our clients do, it's been right around 5% for the past 3 or 4 years, but it's increasing right now. We're looking at more of a 6, 7, 8% trend. And so what we thought would be interesting would be to figure out if we could project the impact of extreme climate events on those healthcare costs? And at what point would they even add another percentage point to that healthcare trend, those healthcare costs that businesses are so focused on? And so we got together some of our actuaries, and we have been working for quite a while now on this climate health forecaster. It's a model that will provide a 10-year projection of the impact of climate events on medical claims. It will be launching on May the 5th. We have a firm date. The developers have actually converted it to a model on a site that you will have access to. And basically what we did was we used publicly available data on heat, flood, hurricanes, and air quality. Those are the 4 perils that we focused on. You can see the sources of our data there. We looked at the historical data, and then we projected it forward 10 years. When you do the model, you enter information on the industry that your population is in. We make an adjustment using the ONET data from the Department of Labor for industry. We have not quite as much data as Hakon has, but we have about 1 million lives in a data warehouse that we used to look at claims data for each of the climate categories. And we made some assumptions. Of course, we're actuaries. That's what we do. And so we made trend assumptions, and we've done projections. And so what I want to do is just show you a sample of what the output will look like. So I know this is a little hard to see on your screen, but let me just orient you to what you're looking at. So you start off with the average cost of providing health care to your population on a per employee per year basis. There's a default number there. It's from our survey data. If you know what your number is, you can put it in. We ask how many employees you have and what industry you're in. And then you can see the 4 lines on the left side of the screen are spaces to enter for MSAs, 3-digit zip codes. And so you enter your zip codes, it'll populate where it is, and then you tell us how many people you have in each of those locations and the percentage of the people in the location that are working in a climate-controlled environment. And an estimate is fine. We're just trying to figure out, is it 0, is it 100, is it somewhere in the middle? And then what we do, the 2 graphics that you see on the bottom of the page, the one on the left is the claims cost increase year by year. The one on the right is the cumulative. And if you'll notice, if you look really closely at the graphic on the left, you'll see the top line is a little dotted red hashtag line. That is the 1% trend line that I was speaking to. And so for this particular group that you're looking at, the line below it is the total of all 4 perils, and they cross that 1% trend point 9 years out. And so basically the punchline for this is at some point this group does hit that additional 1% threshold on their claims data. I also just want to draw attention to in the middle, across from where you've got your locations and your zip codes, you'll see the top peril by location. And for this particular sample that I'm showing you, it's extreme heat for the first one, air quality, and flooding. So it's not the same in all 4 locations. I will just tell you, having run the model a bunch of times for different groups, we see extreme heat as a top condition in many locations. And one of the reasons for that is that there's more health conditions associated with extreme heat. So it's not unexpected. We're hoping that businesses will use this data just to get a glimpse into what their risk is. The other thing that I think it's helpful for is as businesses think about their vulnerability of their individuals and how to build resilience, knowing what the top peril is that's a threat to them is a really great starting point as you think about, okay, what should we do to address this and to build resiliency? So we're very much looking forward to launching this. Like I say, May 5th is the big day, and we'll make sure you'll see it, I'm sure, on social media and other places, and I hope you'll go out and give it a try.
Thank you, Tracy. Dr. Gracia.
Thank you, David, and good afternoon, everyone. It's such a pleasure to be here with all of you. Again, my name is Nadine Gracia, and I'm here with Trust for America's Health. I'm commonly known as TIFA. We're a nonprofit, nonpartisan public health policy, research, and advocacy organization that's based here in Washington, D.C. And our mission is promoting optimal health for every person and community. And we do that by advancing evidence-based policies and programs that help to improve health and that also work to strengthen the nation's public health system at every level. And so from the perspectives on this panel, I'm really sharing the public health and prevention perspective and the importance of addressing, protecting workers, certainly as we address the climate and health crises. For TIFA, we have several policy priorities that we work in. Certainly relevant to this panel is talking about public health preparedness. We know how critically important, as you all know, preparedness is as we talk about a changing climate, and specifically the role of public health preparedness, certainly in safeguarding health, but also helping to strengthen the economy and protect our national security. And for many years, our organization in particular has released a annual report called the Ready or Not report. It is focusing on really an all hazards approach. We released this year's report just last month, focusing on how we protect the public's health from diseases, from disasters, and bioterrorism, recognizing the importance of this all hazards preparedness approach to assuring that we have strong and healthy populations, a strong system to be able to respond to any form of crises, and certainly think about the readiness and response systems across sectors. This is a report that really focuses on an assessment of our nation's level of readiness and states' level of readiness, where in particular we look across a set of 10 indicators, and we'll talk a little bit more about the report during the context of the panel in our discussion. But look across 10 indicators that are aligned with emergency preparedness. And then from the data, as well as from the evidence and research that we gather, then put forward actionable policy recommendations that federal, state, local policymakers, other officials, health officials, and other sector leaders can use to really work to improve emergency preparedness in their states and largely across the nation. Certainly we know, and it has been a topic of the summit today, that we know that these types of risks disproportionately impact certain populations, and so certainly, of course, also prioritizing the importance of equity in this preparedness planning and response. Really, as a result of the work we've been doing in public health preparedness, we also have a focus on climate and health specifically, where again, reports and other resources that we share, the evidence, the data that show the importance of health impacts of climate change and how we can take actions to really bolster our systems to better protect the health of the population. And you see a set of the resources that we have there. We also, importantly, in collaboration with coalitions and through our teams on our staff, really work to do the outreach and education to policymakers in coalitions, in other sectors to be able to address these important issues as we think about the impacts of climate on health and our national security. We've heard some of this presented already in terms of these intersections as we think about the climate hazards, what that means in terms of health impacts, and what that means in terms of economic impacts, and importantly for businesses and employers. And here just really showing, for example, 3 climate hazards that we know are relevant as we think about the interests and needs of employers as they're thinking about workplace protections and worker safety, from extreme heat to poor air quality, both indoor and outdoor air quality, as well as looking at the intensity, for example, of these types of storms and other disasters, that you see these types of health impacts, whether they're health impacts that are created by these types of hazards or that are exacerbated by these hazards, whether it's forms of heat illnesses, respiratory issues, injuries, infrastructure devastation, all of these issues that can certainly promote health hazards, but also exacerbate existing health conditions. And then the economic impacts that we see. Certainly, for example, in productivity losses, higher healthcare costs, we've heard this already, as well as issues such as supply chain disruptions, where businesses may also have to close, and the impacts that that has for communities, for employers, but for the workforce itself as well, and when we talk about its health and its resiliency. So what is public health's role? What can public health do, and how can it help to support these issues? I think it's critically important. Public health clearly acknowledges that when we talk about issues of climate, this is a public health issue, and thinking about this holistically in terms of populations, when we look at economic impacts, for example, that the business sector is addressing, where public health can critically be an important partner to address and help to prevent and or mitigate some of these issues. Whether that's, and you hear a lot of us talking about data, certainly population-wide, that is something that public health is intimately involved with, is thinking about these health impacts, looking at the data, and then being able to develop, for example, the type of occupational workplace protections, policies, protocols that help to support and protect workers' health. We talk about the resilience of the workforce. Well, building a healthy workforce means also having healthy communities at large. And so that type of workforce and community resiliency is also an important place that public health and prevention has great expertise and work in, and that does work each and every day. To also then taking things to scale so that we can have applicability across sectors and across industries to identify where the evidence is showing that there are certain things that are that can be replicated in sectors and other things that need to be tailored, and really understanding the data and the evidence to be able to do so. So I look forward to talking a little bit more in depth about certainly our report, but also the opportunity to bring these sectors even closer together to be able to truly strengthen protections for workers and really have a healthy and thriving workforce and thriving economy.
Thank you, Nadine, and thank you, everyone. I think the presentations there show the two puzzle pieces at the intersection of climate and workforce health. One is how climate affects health, and then what is the business case for businesses to act on that? And so I think that was a great primer for some of the questions we'll get into now. Okay. So I'm excited that we have truly a multi-sectoral panel here, and each of you bring unique experience to this topic. So we've touched on it a bit already, but I'd just love to go through briefly here. From each of your perspectives, how are climate-driven events like extreme heat, wildfires, poor air quality, and severe weather already affecting worker health in the US, worker health, productivity, and resilience, excuse me. And where are businesses stepping up effectively, and where do gaps remain? Jared, do you mind?
Yeah, no, this is a tough one, especially in places like LA, where we had plenty of health workers who did lose their homes. We lost a few clinics during the wildfires as well, so you can imagine the impact that has if you lose your primary care physician and their clinic, right? And so what does that mean for you, your healthcare access to your medications? So there were a lot of considerations. I would say the mental health burden is what I see the most from our workforce. Just people are very frustrated going to work. We're already burned out in healthcare, and then to add these stressors, and these are the realities of our patients, but also that we're living those realities, and we see it worse during the disaster when we have to go to work while we're also worried about whether our homes are burning down or whether we need to evacuate our children, but we also have to respond and be on the front lines. So this is a real disaster. We had some taste of this during COVID-19. I feel like this is actually more extreme, and we're not talking about it enough.
Thank you, Jerry. Nadine?
Thank you. To build, I think, on what Jerry is saying, you know, extrapolating that to then the population level and thinking about that in terms of public health and prevention, seeing the growing intensity and severity of these climate crises and climate-related events, to also the growing severity of them, and seeing that, you know, any and every community can be impacted by these, and knowing that the health impacts, as well as even the economic impacts, but the health impacts we know can be prevented in many cases. And if the stronger that we have our preparedness systems in place, when we think about extreme heat, for example, heat-related illnesses, that heat-related illness, whether it's heat illness, even heat stroke, how we actually work towards preventing and doing greater outreach and education and building the systems and conditions that actually promote health and resilience before these types of events happen, and when these events are happening, to assuring that we actually have systems in place that are strong and robust to be able to actually respond to those. The growing number of crises means we have to work together across sectors, and that is a space and a place that public health really works in, because we recognize that, you know, our health is driven by much more than what happens in the clinic, in the hospital, in a provider's office, but it's the conditions in which we work, where we grow, where we play, where our kids play, where they go to school, and fostering those types of conditions that actually are better prepared for those types of threats, including climate-related threats, are the ways that indeed we can also ensuring that we're protecting the health and well-being of communities and helping the well-being of the workforce as well.
Thank you, Nadine. Tracy, I'd love to hear your thoughts on this too.
I would say from a business perspective, what we've been through the past however many months you want to go back has really been a wake-up call for businesses to be prepared for any of these things that could potentially happen to your population. And I think that's really where the focus has been. Yes, it is a health issue, and we have seen health issues from extreme heat days and from other perils. But I think, when we think about the hurricanes that hit Florida and the terrible flooding in North Carolina, and then you add to that the wildfires in LA, and then, tornadoes in the Midwest, and then most recently flooding in Kentucky. Those are things that have had just devastating impact on workers, on fellow colleagues. And so I think that, having a plan across the organization for dealing with these disasters before, during, and after, and just doing everything that a business can to help build resiliency and be there for their employees has a very strong focus, just given, what we've been through the past several months.
Thanks, Tracy. Hakon, anything to add?
Yeah, I mean, I would just add, I'll touch on the second part of your question. I think there's still an awareness gap that exists in the marketplace, including with like HR executives, including people at my own organization, quite candidly, where, we're seeing impacts, but we're not attributing certain impacts to the environmental exposure. And so my vision with the research that I shared, it's to kind of maybe create additional awareness of what's happening and how it's impacting, once again, not only our health, but also our healthcare cost, our healthcare utilization, because that gap exists. And so on the extreme heat, we can see that it is impacting health, it's impacting healthcare utilization and cost. We're also going to be examining wildfire smoke, kind of taking a similar approach. It'll be more region specific, unless we experience Canadian wildfires again, like we did a couple years ago. But my vision is to kind of build a portfolio of environmental exposures, eventually getting into, different types of vector-borne disease, flooding, everything, and just really understand like what these impacts are. If some impacts decrease utilization and cost, I want to know what that is as well. I'm not only looking for the increase, I'm also looking for the decrease. And so long term, once again, that vision is to have that full portfolio so we can understand what this is and then fill that knowledge gap with different types of stakeholders. But specifically for us, it would be that HR benefit manager.
Thanks all. I think these answers help illuminate how there's a community and a multi-sectoral approach to all these, and how this is a moment for employers to learn from what is happening elsewhere. And so, Jerry, I'd love to go over to you now. You've touched on mental health a bit here, and I'd love to know, what lessons can business leaders, or as Hakon mentioned, HR leaders or people managers, what lessons can these folks learn from healthcare delivery and from the work that you do to better support their own employees during these crises?
I think especially in the healthcare side, healthcare workers want to be a part of the solution for sure. We're seeing it in our personal lives. We're seeing how it affects our patients. We don't really know what we can do, and I think that's why it's so important that we're organizing the work that Medical Society Consortium is doing over with Dr. Patel, and what Climate RX, being able to provide clinicians materials that we can engage our patients in conversations of what they can do on these extreme weather-related days, these extreme heat days. Whether it's distributing air filters, whether it's distributing the fans and electric utility shut-off assistance programs that we're filling out paperwork, all of those things are helping our patients. And I've noticed that the workforce feels good about being a part of the solution, they want to do more and they don't know exactly what they can do. So much of what we can do right now seems in the adaptation side of things too, and I feel that we don't talk and engage the workforce enough on the root causes and the mitigation piece. And so I think there's a real hunger to see action from our leaders on the decarbonization piece, which is why I think health workers would like to see, standards from the Joint Commission or partnerships with health plans on incentivizing our hospitals and clinics to take steps to not only adapt, but also to mitigate, and that there are financial incentives for doing so. And hopefully we can show through data that there really are cost savings to the system, but all that feels so nebulous on the front line so often.
Thanks, Jerry. Yeah, I think the blend of mitigation and adaptation and the fact that we're talking about both those things today, I think is a step in the right direction. So thank you. Hakon, I'd love to get into the research a little bit more. The exposure research there and the air quality research, the wildfire research you mentioned, I'm sure will also be insightful. Could you just dig into a little bit more of the details about how these trends will impact healthcare utilization and what might we expect to see in the future?
Yeah, so the part I didn't share earlier is that we did a benchmark based on a time period. So we used a 30-year look, 1980 to 2010, as a benchmark, and we're trying to figure out healthcare utilization based on temperature. Within those, we don't have the slide, but the temperature bins that you saw on the slide, looking at that average over that 30-year period, and then comparing it to 2016 to 2023, a more recent time period. And it's interesting. I mean, we're seeing the warming trend. And just a few points. So during that time period, and folks probably are already familiar with this, but we've seen 9 more days over 80 degrees between 2016 and 2023 compared to that 30-year benchmark. What's also interesting is we've seen 3 fewer days less than 30 degrees, and this is across the United States. And so for us, using that environmental data, once again, using that to overlay our claims data, what this means is we've seen an increase. So I used the number $15 or $16 earlier per person per year from an impact of 80-degree weather and higher. We've seen that increase. So we've seen a couple dollar increase today, presently, and using a little bit of scenario planning. So the folks in the room that they use scenario planning, not like a full scenario analysis, but just trying to start to move in that direction. We're projecting an additional $2 increase per person by the year 2035, and then a $5 increase by the year 2050. This is on average. So this is across 35 million people, some of which may be healthy and may not have underlying conditions or social needs or other things. If you start to isolate to certain populations, like that number grows to $20. And so the other thing I want to do with this research is start really high level, all cause, all care settings, 35 million people, but start to focus in on where are we spending $200 per person, with the motivation, once again, controlling the cost, controlling the utilization, but also improving someone's health outcomes, keeping them out of that emergency department. So we are seeing that warming trend. A little bit more work that we need to do. Like I said, this hasn't been peer reviewed, but that's how we're thinking about it.
Thank you, Hakon. Tracy, going over to you, building on sort of the comments so far, you've led the charge helping businesses understand climate impacts at Health Impacts at Mercer and through your work and leadership on the National Commission on Climate and Workforce Health. I know one area that you're excited about, and I'm always excited about, is the innovative workplace policies or benefit strategies that companies should be looking at to support worker resilience. So what would you say to what practical first steps do you recommend for businesses to take looking to develop an effective climate health strategy?
Yeah, I think there's probably 3 things that I would say. The first is it's likely that within your organization there's already a work group focused on the impact of weather disasters, from sustainability, from your risk manager, operations manager, those types of leadership functions. The HR and benefits function needs to have a seat at that table. And what we find in talking with our clients directly is that if they don't have a seat at the table, they're not as connected and as knowledgeable about what the organization is already doing and how they might supplement those efforts and where their efforts are definitely needed. So I think having a seat at the table is by far the first thing that needs to happen. The second thing that is just so critical is having some type of functionality in place where you can communicate with pockets of people that are in the line of some type of a weather event, so that you can communicate with them ahead of time to tell them things that they should be doing to be prepared, so that you can communicate with them immediately following to ensure that they're safe, or that they can get someplace safe, what's going on with them personally. And then after the fact, for those that have been impacted, what kind of help do they need, and getting them that help. And so that communication is so important. And I think that in this past 6-month period that we've been through, that there have probably been organizations caught in a situation where they did not have a way to communicate with their workers. And so I just can't underscore enough the importance of that. And then third is to have a plan to prepare for the disaster. The plan might be, when people are in the harm's way of a threat, do you want to be sure that they can refill their maintenance medications before they have to evacuate, if that's the situation that they're in? Or when a disaster is hit, if somebody, in the moment of trying to get out of their home or, away from harm's way, didn't take their eyeglasses or their contact lenses or something like that they're going to need. So really thinking through every single aspect of a person's personal health and what they might need in any given situation. Faster access to telemedicine, faster approval of a disability claim, help with a property insurance claim. I mean, just go through the whole list of anything that somebody might need help with and figure out what is your plan to be able to provide that help. So I think those are the three things. Be on the team, be on the leadership team focused on this, be sure that you can communicate and have a plan.
Thank you, Tracy. Nadine, building on the preparedness theme that Tracy touched on there, TIFA's latest report is focused on preparedness gaps, especially or including extreme heat. I'm curious, you touched on it on your slide there, but what findings are most relevant to the business community, and how do you think businesses can use these insights to better protect their workforce?
Yes, thank you, David, for that question. So again, when looking at the Ready or Not, our preparedness report, it really is looking at public health emergency preparedness across all hazards, whether that's infectious disease outbreaks, which are happening, many happening at the same time, whether that's measles outbreaks to seasonal flu and other types of outbreaks, to disasters, as we see, for example, with climate and environmental related disasters, to bioterrorism. And stating that in order to have a better response to these types of emergencies and disasters, we want to have a strong foundation that's able to address this in terms of the data that we have and data infrastructure, to the disease detection, to the workforce that we have in place, to the policies and procedures that we have, and to that ability to work across sectors to be able to assure that we have these strong systems in place. And as Tracy noted, that the time to do that is prior to the emergency, building those systems, strengthening those systems and those partnerships so that you're ready to surge during times of crises and emergencies. This report in particular, across these indicators, as you look at them, they're looking at things like the ability for states to have surge capacity when these types of disasters happen, either in terms of healthcare or the laboratory capacity. It's also looking at issues like immunizations. And one may ask, why are we looking specifically at rates of immunization? It's telling us that during a time of crisis, it's serving as a proxy. If we look at what is the percentage of individuals who are actually getting the flu vaccine, can serve as that proxy to say that when we have an outbreak or a pandemic, can we rapidly deploy and be able to do vaccinations quickly in communities. There are also policies that we can think about, and in particular with regards to the business community, are indicators like paid time off. We saw this in particular spotlighted as we think about the COVID-19 pandemic. The number of essential workers, and many of whom were at the front lines of addressing the pandemic, but were often in low-income jobs, or were workers of color, or were in areas where they were at higher risk of exposure, but may have not had the ability to take paid time off and having paid sick leave policies. This is something that, because we don't have a national standard for that, although we are advocating for that national standard, standard around paid sick leave is businesses taking that action to have, for example, paid time off for their workers. The evidence actually showed when you have those types of policies in place, workers are more likely, for example, to utilize preventive services, that's cancer screenings and other forms of screenings, to actually be able to help address reducing these types of healthcare costs. That it also helps to promote worker retention, worker recruitment, and helping with business stability. So having that ability to increase worker utilization and having the ability to have paid time off is a critical indicator that we include. There's also the issue around avoidable mortality. That's a new indicator that we introduced into the report this year that talks about preventable and treatable causes of death among individuals less than 75, that if we had stronger investments and stronger public health interventions as well as high quality healthcare interventions, that we would be able to actually prevent these types of avoidable deaths. And when we talk about workforce resilience, we've been talking about mental health, the burden of chronic disease. The more that we have those investments, whether it's in benefits design, the opportunities to promote workplace wellness programs within companies to actually have a healthier, more resilient workforce, that too leads to greater resilience and preparedness. A community, including the workplace and workforce, that is more prepared and more resilient, we know actually is better prepared for the emergency, but is also better prepared to recover from that disaster. And so the opportunities, I think, are there, certainly for the business sector to engage and utilize this information and work with other sectors, policymakers, public health departments, to see, look at my state or look at across states. If you have, your companies are in multiple jurisdictions, to be able to look at it and assess where do we fall in terms of our performance, and what's the opportunity utilizing this data and these types of policies to be able to strengthen our emergency preparedness and response.
Thank you, Nadine. Given the time, I'd actually love to jump ahead and see if there are any questions from the audience here. So we have a couple mics standing. We have one coming over here. Just while folks get set up there, on the paid time off example, one thing we've done on the commission is looking outside the U.S. also at best practices, and some folks may know this, but after the floods in Spain last year, the Spanish government passed a climate leave bill. So now every employer in Spain is required to provide 4 days, which I believe accounts for evacuation and response and things like that. So not sure if that's on the menu right now at federal level in the U.S., but I think it's interesting to see how those innovations are happening here and elsewhere. Please.
Hi. Great talk. Love all these business suggestions. I'm just curious, looking at the timeline, I love all the data on 2030, 2050. How do we get businesses to understand the urgency? So it's not just a discussion of our possibilities, but a pressured response where if it's a disaster and emergency, that response happens from the businesses.
Anyone want to?
Can I just start by
Please.
saying, we really don't have the luxury to wait. They can no longer afford to not respond. And so I think that's what I really appreciate about this panel is now we're going to have to make those numbers and sense arguments, but it's no longer this theoretical. It's no longer whether you believe in this, philosophical idea of does climate change exist or not. It's no, your workers are not going to show up. No, your communities are burning down. This is how much it's going to cost you. Are you doing these things to reduce that risk?
Thank you, Dre. Anyone else want to weigh in on that?
Yeah, I'll just say, I think that the work that we're doing across the commission, certainly the data that you shared and what we've been working on, that helps employers quantify for their population, for their business, what the impact is, what they're dealing with, will make it more real. We know from published data that climate disasters cost businesses $150 billion a year is the most recent figure that I've seen, that 1 in 4 non-elderly workers are in some type of job where they're at risk for climate-related health issues. But those overarching data points feel more like, oh, that's everybody else, not us. And so I think having the data to really help make the business case for an organization as their call to action, if they haven't already heard the call to action, is the path that we're headed down. And I think that we will get there very soon.
Thank you, Tracy. Dr. Patel.
My question built off of Dr. Holder's, which is the political moment we're in. I mean, we know what makes sense, but we're seeing people do lots of nonsensical things. And so I'm just curious, what has been the response of businesses to this? And I guess, is there a rational path forward with the data, or how do we navigate the irrationalities of what should be done given the larger political context and fear and repression that we're seeing from the government?
Lucy?
I think so, because I honestly think that business leaders care about their workers, at least from the work I do, from where I sit. Hopefully everybody else feels the same way. The data clearly suggests that we're seeing an increase in weather-related disasters. You can call it whatever you want to, but there's strong data. When you just look at the data published by the government on billion-dollar disasters per year, we've clearly seen an increase, and a huge increase the past most recent several years. And so I think that helping businesses understand specific for their organizations, where are they vulnerable, which locations, what are the perils, what can they be doing, how can they build that resiliency. I think, that's the path that we're going down. And I don't really see that as being a in style or out of style type of approach. I think it's just being compassionate and taking care of your people.
Thank you, Tracy.
Hi there. My name is Erica. I'm a nurse and the founder of Kimball Sustainable Healthcare. I have a question about driving decarbonization inside of the healthcare sector. There's definitely a lot of talk today, rightfully, on adaptation. I think that clinicians really have a critical role to play right now as health systems try to figure out how they stay on track with decarbonization. It's great to see Elevance really including that focus on decarbonization still in your model from an economic case. And so I'm wondering if you have any thoughts on how we can support healthcare workers to put them at the table, because I think that they have an ability to cut through the noise and really keep our health systems honest to keep driving this progress. Thank you.
Yeah, I mean, and maybe, Lisa, this answers part of your question as well. I think the framing on decarbonization, we need to get, and we already do this, but maybe lean more into, high value care, cost efficiencies, and reducing the total cost of care. I mean, there's an energy burden. I mean, our health system spends billions of dollars on energy every year. And so maybe the narrative is more around, efficiency, high value care. It's less about solar panels and electric vehicles and other things. And I would say that's true for clinicians. I mean, clinicians want to provide care, but they also want to ensure that there's access to care. And to ensure there's access to care, you have to reduce the total cost of care. And so maybe leaning more in that direction. We're still trying to figure it out. I'm still trying to figure it out, but that's just kind of one thought I've had recently.
Thank you all very much for your presentations. I've enjoyed it very much. I have a question in reference to, all of us understand in here that it is important for us to be prepared because the next disaster is right around the corner, right over my shoulder. And as we talk from big business, private sector, when you look at the trend that has been going on, how do we feel comfortable at night knowing that a part of the system is not there, and that part is the government? When you have the NOAA and the CDC and the EPAs and all of the other programs, FEMA, that would step up to help us with these disasters when they occur, we don't have that part of the plan. So what is the next step for us to make sure that that is covered so that the vulnerable populations that are going to suffer the most will not continue to suffer? Thank you.
I'm happy to start, and thank you for that question. I think importantly, it is a critical moment. For public health, we're at an inflection point when we talk about the resources, the infrastructure, the workforce itself at all levels, federal, state, and local, to truly safeguard the health of communities across this country. I want to piggyback on something that Tracy spoke about earlier in her response about business leaders and an understanding that, one, whether there are levers of engagement that are there or not, the importance of businesses being a part of this solution is critical, and that there's opportunity at the state and local levels in terms of what's the innovation that we can have working in state and local communities to assure that we're really working to address the safety and health of our workforce. I will say, in terms of the government, and in particular for our organization as a nonpartisan organization that does that advocacy to, in particular, federal lawmakers, Congress, and the administration, it's important that we continue to really advocate for and urge the importance of these programs, the importance of the construct of these agencies and the work that they do, and what it means in terms of impacts in local communities. When we talk about, for example, the CDC, and the resources that it provides to communities, the technical assistance it provides to communities, quantifying that 80% of CDC's domestic budget actually goes out the door to local communities, to states, to academic institutions. So this is not funding, for example, that is sitting just here in Washington, D.C. or in Atlanta, but it's actually the funding that's going to support those local communities. Lifting our voice to continue to express the importance of these types of the funding, of the infrastructure and the workforce and the policies to assure that we're actually promoting health, but that we're also protecting our economic security, our national security, that this is an investment for that is critically important. And I think what we all can do, and especially those of you that are working directly in communities, is lifting up those stories, is talking about the value of this work, what it means, and what suffers if we don't have that type of a resource. But it does mean that we also have to think about who are the partners that aren't at the table, and how do we assure that we bring those partners to the table to be able to address not only workforce health, but our health more globally in terms of the health of the nation.
Thanks, Nadine. We have time for one brief question and one brief answer.
Wonderful. This is a question from our online audience. They say, I noticed the data sets presented were often based on federal data. With the defunding and disappearing of these sets, can the private sector, and specifically the healthcare sector, become a new source of climate impact data?
I can answer that just how we're thinking about that at the commission, then if anyone wants to weigh in. I think the quick answer is no, and we're figuring out what we can do. I think the commissioners that we have and the business leaders and the public health leaders, we're all processing what data will not be there and what support will not be there, and where businesses can step up. And I think that is a place that we have, for instance, we have a public policy working group on our commission, which is co-chaired by Dr. Gracia here, and we're thinking about how do we educate business leaders on what might disappear? How will they think about data around extreme weather and storms if NOAA is not providing that data? And so it's early, but that is an area that we're thinking about where we can have businesses step up and play a leadership role here. Anything to add? Okay, we're 5 seconds over. So I will say thank you very much for your questions and engagement. Thank you to the panelists and appreciate it, and see you all after a short break.
Thank you all again. As our moderator mentioned, we'll now have a 10-minute break or transition period. For those in person, we ask that you please stay in the auditorium unless it's necessary, as the closing plenary will start promptly at 4:35 p.m. Eastern Time. For those joining us virtually, you can continue to watch the live webcast of the closing plenary on the NAM event webpage. Again, the closing plenary will commence promptly at 4:35 p.m. Eastern Time. Thank you.